Greetings to all. We are group number 2. Myself, George Sunil, just along with Jasprit Singh and Harminder Singh Sagi. Here, we are going to discuss about the health issues related to St. Joseph Healthcare, London. Next slide, please. Now, I'm going to discuss about the introduction part. The health challenges has been increased tremendously, and one of the main reasons behind this increase is due to the increase in aging population. As we know that the aged people has been increased and the nurse shortages has affected that adversely. And the next one, it will be, there is a no proper source to identify the real supplies of the healthcare sector, as there has been a tremendous fall in the number of nurses. So a quick and remedial measures are required in this area to sort out the issue. And a comparative study is much required to sort the issue in a global scale. So comparison between different hospitals or different sectors will be a quite good area to recognize in this part. Next slide, please. The problem statement of ours is nurse shortage. Next slide, please. Here we are going to identify some of the reasons. As we all know that there has been tremendous demand in the healthcare sector. And some of the reasons are the nurses are retiring at an earlier age. Then they points that there has been an unhealthy work environment and a heavy workload pressure experienced by the nurses. So an immediate measure has been required in this point. Then depending upon the educational qualification, there may be required some clarification, like the educational qualifications are dependent on the nurses, how they are prolific, and it is varied according to the countries. So it must be sorted out in order to safeguard the work environment of the nurses. Then the government fails to fill the open faculty roles in many cases, as they are not able to identify the skilled and professional employees in many cases, so they fail to fulfill the open spaces at the faculty roles. Next slide, please. Here we are going to discuss about some of the important consequences due to the nurse shortages. The first one and the most important one, it will be, it causes extreme shortages in the field of healthcare, and the turnover rate has been increased rapidly. Then the patient has been affected adversely, like the mortality rate is increased, and also there has been other several negative outcomes. Then it causes some preventable complications from the part of the nurses. This is due to their laziness and carelessness, as they are doing a stressful job and taking some extra hours. This causes them more complications in the field of healthcare. Then they are facing some of the illnesses like the fatigue, then dissatisfaction, injury, pressure as part of their profession, and there were no suitable measures were taken to consider this issue. Then the most of the departments, especially the emergency department, were overcrowded, and there were not a suitable system to maintain and also to handle the situation. As nurse shortages is a tremendous issue, these are some of our consequences. So the next slide will be presented by Jasprit Singh.
Thanks, George. I'm going to talk about the extent of our project. The first one is the application of artificial intelligence. The next is telepathy, health telepathy, and third is the mobile application. Talking about the recommendations on applications of artificial intelligence, I would like to we will recommend to improve the workflow of the nurses so that they can multiple nurses can work on a single multiple time rather than they have to make the multiple shifts, and they all the nurses will not get the equal work in the tranquil environment. Talking about the next Talking about the next recommendation, that is the telehealth policy. We decided to make a software that enable the nurses to work remotely rather than moving to the other places. That will help to improve the social distancing, and they will then there is no need to attend the patients personally. Talking about the mobile applications, we recommended them to prepare a mobile application so that the nurses can work in a small radius, and they all the nurses can uh, take the shifts according to their availability. Talking about the requirements of the nurses, it helps us to know how much there is a requirement of the nurses in each hospitals so that they can work according to the availability. Um, Our main focus is on mobile application, which will be explained by Harminder Singh.
Thank you. Now we'll continue with the presentation for the mobile application. First of all, we are deciding to make an application which will schedule the shifts as per the requirement of the hospital as well as the availability of the nurses. For that, we have this is like a demo or sample homepage of the application that we have made, in which there are three major shifts which we can plan. Basically, the average time for a nurse to work is 12 hours, but if we can cut down that to 8 hours, that will give us night, day and afternoon shifts. For example, as I have mentioned that in Tuesday I have put my availability as A, and Thursday as well as on Saturdays. For now, Tuesday has been marked as S. That means you have been selected for that shift, and we might have assigned you a hospital or a location that you need to go to. Next slide. This is just a representation of how I have done it. Basically, the scheduling will be done at least a week prior. Nurses will put in their availability for a week, as well as hospitals will give how much of the nurse force is required for them, as well as marking. I've also explained the letter of A and S indications. Moving forward, this is the timeline for making the project. Basically, we are going to have a meeting with a lot of hospitals, then we'll create the software, then we'll feed in the data. Means this will be an AI based application which will automatically assign nurses as per their requirements, as per the requirements of the hospital and availability of the nurses, because different skill sets are required in different hospitals. Then after that, we'll be having a trial period which will last for like 8 days only. Then we'll have a maintenance break in order to just recover any losses, or just to find out any errors which might have been popping up recently. Then we'll set up for the final deployment, and this will last for just a day, and will then have a periodical maintenance break in between whenever it is required. So talking about investment and returns on it, basically in the market, as we have researched, the average cost is $500 just to make an application. That includes building it and designing as well as launching of the application. So here I've mentioned the average shift of a nurse is 12 hours. So basically, if 20 hospitals are asking us for approximately 100 nurses, we can ask a commission of $1.5 from their salary for an hour. The reason being, we are opening up as an agency and we will be registering ourselves as an agency. So we'll make $150 from these 100 nurses in an hour, which will total out to be $1,800 in a day. So basically, we'll be hiring two schedulers, and we have decided their pay to be 16 per hour, which will be 256. Now 256 is for two people. So for two schedulers, in the sense, we'll have a 12-hour, like starting from 7 a.m. to 7 p.m. One scheduler will assign all the shifts, and starting from 7 p.m. to 7 a.m., other another scheduler will assign them shifts. We are still left with $1,500 a day, which will be distributed amongst other costs and other representatives when we are opening up an agency. Now, if we look at these numbers, we will be able to start making profit within a week's time. And that is pretty much it about the application. Thank you. These are some of the references which we have used, and that's it. Thank you.
Thank you.